SPARSH Hospital achieves medical milestone with complex split liver transplant, saving 2 lives.
As a group, I think our vision always has been, as stated by our chairman, it is about, we want to be seen as a destination for complexity, for complex surgical work. And I think this particular case that our team has done here of split liver transplant, where we've been privileged to save 2 lives. This validates the kind of work that we want to do, that we are doing, and that we want to do, continue to do going forward. I also just want to, just highlight that, we are very privileged that we've been involved in saving these 2 lives, and to have been involved in being able to give this care to our patients. And this has been possible only because of the strong clinical team that we have across our group. We are 4 hospitals in Bangalore and other hospitals in Karnataka. Transplant team, our liver transplant team, which I think is best in class in South India today. And also the kind of equipment and infrastructure that we have, which enables us to do this. And the team which has supported in making this complex, beautiful outcome. We are privileged in this. We thank you all for being here. And now I will hand you over to our surgical team.
Thank you all to come and in taking some time out from your precious day and come here. The reason we wanted to highlight this is at this moment we have a severe shortage of donor organs. We, with one donor, can get 1 liver. And there are multiple, more than 1,000 patients waiting for liver at this moment. And there is a severe shortage. So a lot of people die on waiting list, waiting for the organ. So in that case, we have to use different strategies to make sure that we can increase the donor pool. Basically, make sure that there are enough organs for patients waiting on the waiting list as such. So to increase the donor pool, one of the strategy used is split liver transplantation, which is we use 1 liver, cut it into 2 halves, and give 1 part of the liver, right lobe usually, to the adults. And a smaller part, which is the left lobe, we give it to the child. What's unique about this case is we could use the liver in 2 fully grown adults successfully and with good outcome. Now, why this is a rare feat, not many cases has been done with this kind of 1 liver used in 2 adults, and that's why we wanted to emphasize on it. Very important thing to do something which is so complicated is to make sure all the logistics are taken care. Once we teammates who worked incessantly and without any tiredness to achieve this thing. Thank you.
Important in achieving this kind of successful outcome. Every step of the procedure, right from selecting donor, who is a good donor, where we can cut the liver into 2 halves and use it for 2 patients. That is where the process starts from. And once we identify a organ donor who's suitable, whose liver can be split into 2 halves, then the next step will be to identify, how to do it. Like, we have to do multiple scans, identify those blood vessels, cut the liver into 2. If there is one mistake at any one step, we would not be seeing a good outcome. So every single step is so important here. And we have to make all these decisions in the middle of the night when, probably we are most tired. So this is when good communication, good team, and a lot of support system, that helps us see this successful outcome. Thank you.
Here at this moment, spared time to be part of this significant event. this part of the country, where it's unimaginable a few years, if not a decade ago, to see two people sitting here who have received an organ from one donor. So science has advanced so much that we are able to reach this mile. And like Rahul sir told that SPARSH always yearns to be a destination for complexities. And we take every new frontier as a challenge to achieve and go all the way to achieve that and include that into our service portal. And always we are on the lookout for what's out there in the frontier. So to begin with, all of us understand that for any successful transplant program, the center point would be a wonderful pair of hands. So we have been fortunate and blessed to have that with us. We have a wonderful team of surgeons, which becomes crucial for the outcome of the surgery. But we also have to understand is all transplant recipients have a failing organ to start with. And a major organ like liver, if not functioning, we can understand their immunity is going to be very down. And moment they receive an organ from a donor, our body, a natural response is to push it away from the body, a process what we call rejection. So we use medicines to kind of regulate these processes. So all collectively will compromise the patient's immunity, and that puts them at a high risk for infections. So we, the transplant organization, are very conscious about that and have taken every effort to make sure that a new infection doesn't affect them or an existing infection doesn't flare up during the post-transplant period, which is very crucial for successful outcomes. So in our organization, we keep this transplant cohort.
Ailment that roughly translates to 10% of the population. If you imagine the India's population, 10% of the people have, this includes minimal fatty liver to severe end-stage liver damage as well. The whole spectrum is seen in about 10% of these patients. 10% of the 10%, that means 1% of the Indian population will need liver transplant at some time in their life. So that's again a huge number. And you can imagine how many organ donors there are. You know, there are two ways to get a new liver. One is living donor, other one is a cadaver donor. Living donor is where half the family member shares half the liver with their near and dear ones. Cadaver donor is like what we have done today. You know, people who are unfortunate enough to succumb to a accident or a head bleed. If the family is willing to donate organs, they can be distributed to people who need them. You know, certain family members, even though they are willing, they may be medically unfit to donate half the liver. So such families don't have any other option but to wait for an organ donor from the community. So with a nuclear family being the norm now, smaller and smaller families are there. So even if their family member wants to donate, they may not be fit. So that is part of the problem. So that is one of the reasons why we want to promote organ donation more and more. Say we ventured into this feat of splitting the liver and giving it to two patients. One is risk involved in the surgery, other one is, say, suppose if we had not done this, the one organ would have been given to one patient. And by the time the turn comes, you know, they may be unfit or, you know, like if
Uripurally, common theme again and there. They both have got liver transplantation from the same donor, so they both share the same liver. Right side is shared by Mr. Gangaraju and left side is Varalakshmi. So basically, this is a innovative and very complicated procedure called split liver transplantation we've done, in which a brain dead donor, one liver, is cut into two and transplanted Gangaraju and Varalakshmi to that. Both are doing very well post-operatively. Their bilirubin is normalized. And to tell you the background, Gangaraju had liver failure and Varalakshmi had liver cancer. So they both needed liver transplantation urgently. They both got it and now they are in the recovery mode. They will take another 1 month, 2 months to get back to what they were doing earlier. And one point I have to make, which is very, very important, is that all the transplantations we've done, liver transplantation so far, if things have gone right, they never came back and complained. They always were were very happy, patients were very happy with the results, and they will definitely recommend this kind of procedure with other patients who need it. Thank you.